Wikidontist.com. Truth about tooth.
Hi, I am Dr. Thomas Nechupadam from Nechupadam Dental Clinic at Marine Drive, Kochi in Kerala. Kerala is a beautiful place. You are always welcome to visit us. Now, today I am going to talk about orthodontics and its costs. Why I am talking about it is because cost of orthodontics is something which they ask many times in my YouTube channel, because whenever I say about some treatments, they'll ask how much does it cost. So today I am going to talk about the costs. Why it is important to discuss this cost is basically there are so many costs that is hidden behind it. So there are some people who are offering packages, some people who are telling just for the basic treatment itself. So what is to be known to the patient before they go and start orthodontics with one clinic? They need to understand the total cost of the whole treatment and its allied treatments. So if you are seeing my videos for the first time, please subscribe it. Please click that bell button so that you will get personalized messages whenever I upload a video. I am also available on Instagram and Facebook, so please follow me on Instagram and Facebook, and then share it on your platforms also. I am available on WhatsApp and also on calls, so if you have some doubts, you are always welcome to call me. Now, what is orthodontics? You all know that it moves the teeth around so that you can get a better smile. So when you go to for an orthodontic problem to a clinic, what all you should expect, how much expense you should expect. First thing is the consultation. The consultation cost varies from 100 rupees to 500 rupees in India. So that is what you have to expect as a consultation. Sometimes it goes, even in Mumbai, it might go up to 1000 or 2000 rupees just to consult the orthodontist. Some orthodontists are visiting orthodontists, some orthodontists are having their own practice just like me. So that is exactly the consultation cost. So from 100 to 2000, depending on the place they are practicing, things like that is actually the consultation cost. So now, after the consultation, they will ask you for diagnostic things like to take an X-ray, sometimes an OPG, orthopantomogram. Some people ask for CBCT to understand more about the bone and the thickness and things like that. Some people ask for a lateral ceph so that they will understand how proclined is your teeth, what is the position of your mandible and the maxilla using a lateral ceph. So all these might cost. OPG will cost you from 500 to 1500 rupees. CBCT will cost you somewhere between 1000 rupees to 3000 or 5000 up to 5000 sometimes, and lateral ceph will also cost you somewhere around 500 to 1000, 1500. So that is your X-ray cost. Sometimes if you are a child, they might ask you to take a hand wrist radiography, that is also on the range of 500 to 1500. So that is the X-ray cost. So why is it done? Some people would like to record it, some people for medical record purposes, some people would like to know more about your bone and things like that, and some doesn't want it. So that is the X-ray cost. So when you do the consultation, ask for the consultation, the X-ray cost, whether it is included in the orthodontic treatment cost itself or is it a separate one. Some people take it pre-treatment and post-treatment, so it might repeat once again. So ask for that, because if they are asking for it, you might have to give it. So better ask before you start the treatment. So X-ray cost can be a pre-treatment cost and a post-treatment cost. So just check it out whether it has to be borne by you or is it part of the package. Now the records, sometimes they most of the clinics takes a records, they take photographic records, they take impressions and things like that. So if there is a record keeping department, they might ask you for the records costs also. So that also has to be clearly explained. So records, medical records costs, then there you have X-ray costs. Now then starts the treatment per se. So if you are going to do the treatment, then you'll have to do a full mouth oral prophylaxis or scaling. So that might be an extra cost. Now if you are going for an extraction case, there might be extraction, there might be preparation of the teeth like slenderization or proximal stripping. the doctor might ask you for more, so that is also an extra cost. Some orthodontists also recommend fluoridation, which has to be done, so that also may come as an extra cost. So you should ask all these things before you start itself, because once you start you cannot say no, so they will be charging you more and more on that. Now then the treatment itself, where you start the bonding. So most of the some of the clinics which are talking about orthodontics, they just talk from bonding and putting the wires, and then that itself, the first appointment is what they say as the preliminary cost. So when you call up and tell how much is it to put a braces, they will tell you the cost for just putting the braces. That means that doesn't involve your follow-up visits, that doesn't cost they don't count the follow-up visits or your breakage charges, your maintenance charges, your delay charges. What is a breakage charge? If you have eat something very hard like a chips or something like that, your bonding of the bracket may get loose, and when you go there they might charge you for a breakage charge. Or if you delay your appointment, like if you don't go for 1 month or whatever time they are telling, if you are missing an appointment, they might ask you for more money to get another appointment. So that is also, some people charge for per appointment basis, like to start the treatment it is a cost, and then every time you come, whether it is once in a month, once in 3 months, whenever you go you'll have to pay a charge. So what happens is, in such cases the doctors might delay the treatment to 24 visits or 36 visits, so you might lose much more money than whatever treatments you get as a package. If at all if you get a package, that is much better, because if the treatment is delayed you will lose more money. So now that is also another point. If there is any accessories to be done, like bite planes, if you have to do some accessories like implants, that will be an extra cost. So ask your doctor whether you need any of these stuff like headgears or implants or something like that. That is an extra cost. So just check it out whether you need any other accessories like that, or even if elastics are used multiple times, if you are losing the elastics, if they charge for it, just ask whether that is an extra cost. Ask for all the extra costs, get a package done, and then only you start the treatment. Then at the end of the treatment you need to remove all the brackets. Some orthodontists charge for it because it's not done by the orthodontist, it's mostly done by the dentist. So then the dentist will charge for the removal cost and also impressions and also the scaling. So if that is a cost, you need to understand that also, because the orthodontist will say that will be done by the dentist. So that may be an extra cost. So just check that also off, and also the retention. During the retainers also might cost you something. So no orthodontics is complete without the retainers. So the retention cost also has to be included in the orthodontic treatment. So the total treatment might become very big if you don't understand and ask for all these things. Otherwise you might end up losing much more money than what you should. Or if you are not known, if the doctor is not telling you, has forgotten to tell you all these treatments, or they charge according to the bills, then you might be thinking that this is the only cost, and you might end up spending much more. So to plan your bills for orthodontics, you should understand all these things. Even retention at the end of the treatment, the retention and the maintenance also may be charged by some of the orthodontists. So please check that also out, and also get a full package done if it is possible, or ask for all these details, and then you break it up, put a full this thing so that you can pay it. It can be paid as EMI. Some people give you an EMI, and you need to ask whether there is a interest charge for the EMI also. So all these things has to be taken care of when you start the orthodontics. Otherwise you might end up losing much more money than the orthodontic treatment per se, or you need to get a full package done by the orthodontic. Most of the good orthodontists will give you a package saying that this is the upper limit, this is the lower limit. If you are using these things, this is the cost, and if you are losing some of the brackets, there will be some freeze, there will be more. If you lose more, there might be a charge. All these things has to be known. So please understand this, write it down so that you can go to the orthodontist and ask, is there these charges, or is it all complimentary, is it part of the treatment and things like that, so that you will get a very good communication between the doctor and you, so that you will get a trouble-free treatment and you will enjoy the treatment during the orthodontics. So during the orthodontics and after the orthodontics, don't think about the money. Please think about the money before you start the treatment, so that you will end up with a happy face and a happy smile. Thank you very much. I am Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, giving you happy smiles all across the world. Thank you.
Wikidontist.com. Truth about tooth.